Ahoteofo na adɔfo no mama hu akwaba na mekyie mu nyinaa nso from Newark, Delaware. Nyankopɔn na adom wɔde hia ababio dwumadzi a yɛdzi yɛbɛhyɛ ase apɔmuden ho asɛm a yɛka dɛ ɛyɛ ɔda yɛde Awurade ase wama hɛn da foforo wafem hɛn ano dɛ biom. Ozi kama mu nyinaa kɔ abasoronko de ho ase dɛ mo asɛ mo mbere no ma abɛdɛ mo betie adesua bɛ na ibiri anse na bɛhyɛ ase mpɔkyɛ wo miambɔ mpae. Yehowa yɛn Nyankopɔn yɛda wo ase wadmare kwa ne yɛte ase anɔpa yi sɔre yɛkora yɛaba ka yɛn ho de yɛkora de yɛaba ma obi esɛn mu so apɛdze guda ama hɛn yɛdin bɛhyia biom dɛ akokɔ baatan a waboa no mba no de mbetiew wasema ni bi ba ma hɛn. Papa yɛda wo ase yɛda wo ase ma ayɛ ama hɛn meguru yɛ ma hɛn na dza bɛdze ama hɛn eyimbiri ma yabo apɔmuden a yɛyɛ na wotwe mu ndɛ yɛ ɔda ndɛ ɔtɔdo na Ewuraba a wɔsiesie ndɛ ɔmhia bɛkasa eyimbiri papa yɛde ne hyɛ wo nsa soronko Miss Adlebuati. You know what I can ho mbere no do no so kasa kyerɛ hia papa yini fim na no fim konkrom no bu na no kasa kyerɛ a wɔre kasa fam no mu ma de sua no baba papa hia so a yɛtie mfungwa komapem ne mfombo bronko bu bra. Yɛde wase de tie hia yɛpsande yɛabodɔ mpa hina agikwa Jesus Christ ne zirim no magifo ayibudu na yɛnjuro amen and amen.
Amen and amen.
Okay. Yɛbɛ my brother Kofi Amanse wa me team song na so de me ne sɛ osi a enwom ne sɛ nipa yɛbɛtene nze yɛ Miss Adlebuati dwumadzi odi mahema imbri yɛbɛte. Okay, Kofi, Pocho, take it over.
Odo Jefu Kesina Ben Oni Trimo Bro Jesu Okasama Kuma Tojem Odo Futie Jesu Joma Ejede Wasro Dina Ejede Waha Niji Joma Watupen Jesu Shrafu Jesu Nyonyam kagwa mahoriwon enemiji Yesu di medo hajin kwa panudin medo mi Yesu di Shrafu Jesu Nidin Pama Fobunihu Din Binti Se Jesu Di Omikra Kondo Seti Yesu dina esumbun Joma ejede wasro dina ejede waha niji juma watupe traninchen akajen kwanji hunsen Juma yede wasro Dina yede waha Niji Juma watupen Yesu shrafu Yesu Juma yede wasro Dina yede waha Niji Juma watupen Yesu shrafu Yesu
And amen.
Amen. Amen. I'd like to take this time to say hello to everybody and welcome to our program. Also, I'd like to take this time to thank God for allowing us to come here today, be able to be on the Zoom. And also, I would like to take this time to thank Auntie Afia and the Health Executive Department for allowing me to come to you guys, to speak to you guys, and share the little knowledge that God has given me with you guys. Okay, so before I say Bishas, my name is Adelaide Boateng, senior Uncle Kai, and thank you so much for the wonderful introduction. I am a respiratory therapist. Some of you guys may know, some of you guys may not know. And before I go into the respiratory therapist and explanation, I want to ask a question. When you hear respiratory, what comes to your mind? Somebody come and let me know. Who say respiratory?
Inhaling and exhaling.
Okay, thank you, Akia. Somebody else. What else comes to your mind? This is interactive. I want everybody to talk. So, when you hear respiratory, what comes to your mind?
Being on a vent.
Okay, event. Thank you.
As I want to be home.
Okay, thank you. Okay, two more people. We'll hear
CPAP.
CPAP. Okay, thank you. And one more person.
Asthma.
Asthma. Okay, so thank you very much. Yeah, since somebody said asthma, when we hear respiratory, we talking about this time today, we're going to be talking about diseases. So what are some of the respiratory diseases that we know about when it comes to respiratory?
Bronchitis.
Hey, bronchitis. Another one.
COPD.
COPD, thank you. Another one.
COVID.
COVID, thank you. That's a very big one. COVID is a respiratory disease, if people didn't know.
Asthma.
Thank you. Okay, hold on. Thank you. Let me share my screen with you guys real quick. Okay, so thank you all for everybody that participated. So when it comes to respiratory, the main thing is breathing, like how Ikuya said, inhaling and exhaling. So breathing is such an important thing in our life. Every single day. We don't even notice it. It's something that we just do it unconsciously, but it's such an important thing that if you stop breathing right now, it stops. If everything stops but you don't breathe, that's it. You will not be no longer alive. So when it comes to respiratory, it consists of organs, and tissues that come together that helps us breathe in and out. So when we're breathing, we are bringing in oxygen and then we're taking out carbon dioxide. But in simpler forms, we're just breathing in air and we're taking out air. And the parts of the body that participate in breathing is our nose, yeshune, our mouth, the trachea, bronchi, our lungs, the main important thing, and our diaphragm. Okay, so these things come together and it helps, and all together goes under the respiratory system. So this is what helps us breathe in and out. So hold on a second. Like I said, some of the diseases that we said was lung cancer, like last week when we talked about it in church. We was talking about different types of cancer, and lung cancer is a big, sorry, hold on a second. Can you guys see my screen?
No.
No.
Because about this blank. It still say loading.
Oh, hold on a second. Can you see it now? Sorry, technology.
We can see now.
Okay, thank you. Okay, fixed it. Sorry about that. So today, hold on a second. Sorry. Okay, so like I was saying, these are some of the diseases that fall under the respiratory system. So when it comes to all these diseases, what it basically does, it makes it difficult for us to breathe. And once it makes it difficult for us to breathe, it affects other organs into the body, and then in the body, and then slowly everything shuts down, and unfortunately, we pass away. So today, the main disease that we are talking about is pneumonia. I chose pneumonia because it's a very common respiratory disease, and some people may not take it as serious, but it is very life-threatening, and it has caused a lot of people's lives. So yeah, today we're going to be talking about pneumonia. So before when I was speaking about breathing, this is when you see in the picture is a lung. So in the lung, we breathe in. Once we breathe in, it goes through our nose or our mouth, it goes down our throat, and then it goes into the trachea, and then goes into those two pink things that you see on the screen. So the way they work is like a balloon. So when you breathe in, the balloon, like how when you blow into a balloon, it fills up, and then once air comes out, it goes out, it shrinks back down. In those lungs, there are small little balls at the end of the lungs. And those little balls are also known as sacs, but the main medical name is alveoli. So these alveoli, when we breathe in, we fill those little balls with air, and then once the exchange is done, we bring that air comes back out, and that's how we breathe in and out. So when it comes to pneumonia, those small little balls that the air goes in, no, it gets filled up, so it swells up. Yeah, it shins you. So what happens with those things, it swells up, and once it swells up, the fluid goes inside those things. So because it shins you, know, instead said we're gonna, when we're breathing in, it fills in with air, but because the air doesn't get to go into the alveoli, so we don't get the exchange that we normally do. So because it's swelling and it's filled with the fluid, it makes it difficult for the human being to breathe. So that's the whole point of the pneumonia. No? So the pneumonia is just swollen alveoli that are filled with fluids. Okay, and sometimes those fluids turns into mucus, or you cough it up in basically that's how our body fights it, those fluids, to try to get it out of the alveoli. But that's the whole pneumonia, the whole idea of pneumonia. And so what causes pneumonia? So Pneumonia is caused usually by bacteria, viruses, or fungi. So basically, how do you get those bacteria and viruses? Usually it's spread through it could be airborne or droplet. What I mean by airborne is say obi sneeze and I say obi cough. Sometimes they don't cough in their arm, or they will cough in their hand or sneeze in their hand, and sometimes they'll go touch somebody, and that's how you spread that pneumonia. Or you when they talking to somebody, sometimes you don't mean to spit, but you will spit and then it will land on them, and that's how they also get infected. The common bacterial the name that usually goes with pneumonia is Streptococcus or pneumoniae, or the other Haemophilus and influenza. So these type of bacteria is also what leads to pneumonia. Sometimes when it also comes to pneumonia, let's say you could catch a cold. Once you get a cold, because your body is under attack, the way you're usually, let's say the way you usually breathe, you can't breathe like that. So you get congested with mucus, and then sometimes that mucus goes into the alveoli, causing pneumonia inside the lungs. What are the symptoms of pneumonia? So like I said before, pneumonia is so common, but yet we don't know it's pneumonia until you go to a doctor and they diagnose you and tell you that you have pneumonia. So what happens is that the symptoms are coughing, having a fever, you have chills, and then with sometimes you could get like I said, you have difficulty breathing, you have chest pain, and you become fatigued. Some additional symptoms that sometimes could show that it's a very severe pneumonia is you start to vomit, you have diarrhea, you get a headache, and it sometimes also could be not, I don't know, so you could become nauseous, but sometimes it all goes into hand in hand. But you will know yourself if it's very severe, because you will not be like a regular cold symptoms. Once you get those symptoms, you feel, and you know that, let's say, oh yeah, you caught a cold on Monday. Usually it will take a week for it to be gone. But said this cold is taking longer. When you start to see that, then you go to the doctor, and then they will also take an x-ray to see what's going on within the lungs and why you're having difficulty breathing. And then once they see that the lungs are filled with fluid, they will let you know that it's pneumonia. And they will let you know if it's either a bacterial pneumonia or a viral pneumonia. The most common population that of people that get pneumonia is elderly and children. The reason why in children is because when you see children running around and playing around, they're touching things here and there, so they're more likely to catch these bacteria or these viruses, which will cause the pneumonia. And when it comes to elderly people, their immune system is not as strong. So because a more immune system is not that strong, when they catch these diseases, they turn into pneumonia because their body is not fighting it as strong as it was before. So then it becomes life-threatening. So how do we treat pneumonia? So like I said before, when it comes to pneumonia, if it's a bacterial pneumonia, the doctor will let you know, say, a bacterial pneumonia. So they will give you antibiotics. You treat it with antibiotics. And then if it's a viral pneumonia, you treat it with an antiviral medicine. So basically pills. They're gonna prescribe you pills to take to fight that bacteria or virus. And then sometimes they will recommend you to go to stay in the hospital. Someone will say it's and not only the medicine is gonna help you, they will give you oxygen. Oxygen, no, yeah, inframa. So I won't say oh yeah, home inframa caught in and out. So this one we are giving you medicated inframa, but caught into the lungs since your body can't get to the alveoli. No, oxygen I did amount no to me alveoli, which will push fluid and I shove inside the alveoli outside. So prevention is always better than treatment. So in order to prevent somebody from to getting pneumonia, we are going to practice good hygiene. Like we always say, even with common cold or any type of sickness, practicing good hygiene is very, 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 very important. You want to make sure that you wash your hands all the time. And even the smallest thing, especially people that work in the hospital, where no matter if you're going to a patient room, you're coming out, you always have to make sure that you washing your hands. You have to wash your hands. It's even better say you even take a whole shower, especially for the healthcare workers. When you go to work and come back home, make sure that you take that shower and wash yourself before you go into your room or sit on a couch or do anything. Also, say you are sick yourself, isolate yourself. You isolate yourself by staying inside, avoiding contact, making sure that you're not going to go into public places like how it's COVID by. When COVID came, everybody stayed home. So we wanted to prevent people from getting infected. So you stay home, you wear a mask. And I said, so because we all have to work, unfortunately, with our economy. But if you know, so you're gonna go into a public place, make sure that you are covered. Or if you're gonna sneeze into your arm. If you're going to cough, sneeze into your arm. Do not sneeze or cough into your hand, because you will touch something on, of course, which could infect another person. So you want to wear a mask, and then be cautious of your actions and isolate yourself. Avoid smoking. Fortunately, we are SDA, so we don't have to worry about that. So no smoking. You have to make sure you get enough sleep. Get enough sleep, please, our parents. You guys, I know the economy is hard, and I know we have to make sure we get money, but sleeping is very important. People don't realize how important, like how we spoke, somebody spoke about it on Sunday. Sleeping is very, 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 very important, guys. We have to make sure that we sleep, because when you sleep, your body is resting, and if there's anything going on, it's recovering while you're sleeping. So if you're sick and you're isolating yourself, don't stay up and stay in your room and just be on the TV or be on the phone. Make sure that you are also sleeping and resting the body. It's also gonna help boost the immune system. And then also vaccination. Please, I know there's a lot of theories about vaccination, but we have to please make sure that we get vaccinated. It's flu season coming up. Please, if I'm not gonna be the one to tell you what to believe, but you have to please make sure that you do get vaccinated against the flu, or also they also have pneumonia vaccinations. So please, if you do get pneumonia, or you are at high risk of getting pneumonia, you could also ask to get vaccinated for that. Also, like I said, when it comes to pneumonia, it comes, so with pneumonia, let's say you have a cold, and you cold, is just totally separate from the pneumonia. Diseases can lead to pneumonia. If you have a disease like COVID or flu, it can lead you into getting pneumonia. The simple thing, the pneumonia itself is just the alveoli being swollen. Alveoli na hono ashensu. That's the pneumonia. So because of why you're sick, it can lead into you having the pneumonia. That's the whole thing. So in order for you to prevent yourself from getting sick, if you do these things, you will no longer you will no longer be in a position to get pneumonia. Also, let's not forget the big most important thing is that God is the ultimate healer, and he is also the one that will always be there to heal us. He's the one, even when we go to the hospital now, every day to get the doctors, they of course they know their knowledge, but he's the one that's going to come and give them the knowledge to heal us. So let's not to forget to always pray, always pray, and he is the one that's going to heal us, and he's the ultimate healer. Okay, so does anybody have questions about pneumonia for me?
Oh, Sister Adley, yɛda wase pii, ɛgya mahemmere pii. Agyizefo na wotofo mu online do. Yɛgbe hu a mubotum di bia ka ho so wo questions in. Sister Adley, why ready? Do beti no why One some more questions that home. And see, my one saddle, another unmute yourself. Na ma identify, maybe so question. Me that's it. Yeah, Mrs. Dana McCarthy. Me and you.
Dr. Basho, me that's it. Adley, that's the final shame. Me nimpa pneumonia, hono me ka se awoko obi mu a. Se awoko obi mu a, ti se bia obi ada fa na se anase bibi se ubenya pneumonia. Nti wo foforo kwa yesi chechira kwala no hu na obenya pneumonia wo beko ni mu. Me pacho no sa na ti ana because unchire mu no minnim se bia wo kan na mante bia. Manti bibi sa ba se bia wo yi wo na awoko mu na benya pneumonia. No anya no pra.
So I know it's so pneumonia. No, there's different ways of getting it. It's not say one way now benya pneumonia. No, pneumonia. Oh, I said so maybe so that a fan or to that a fan. Oh, so now that I want to be home. Yes, you're gonna get sick. I don't know your friend no cold. When you're cold will not lead it to pneumonia because when you're cold, no, and no lead you pneumonia. So yes, ubetumi anya pneumonia from sleeping under the fan, but because unya cold no na lead it to pneumonia no.
I see.
Banjo bet mabam kakra.
Yes.
Me boa kakra. Said the associate can say that for respiratory times. And name week. You know, yeah, we show happy respiratory week. Now, I can say Ghana near Qatar and you see our cool one over pneumonia. The also kind of ampa. Now the account be musu say. And I'm say fan no and I say I want a cool mono. Your bacteria and in them, your fungi and in them, and your virus and in them. It is all time I want to say man bacteria no mix with that and in the cool may see what mean pneumonia. No, also look at it. Sa if a flu no call that alveoli no sa and the man can get in the moment. Then the man develop into pneumonia. No, so you see kind of that fine more fine is true with flu. When you flu and the ability lead into pneumonia. But mostly, you know, na bacteria, no, and a fungi, no, and a virus, no, and what some from any woman, a warm pan to me, a survival. So they mention into much miss survivors and that's why crown it or a cool one. Second, you can't get pneumonia because I want the basana, yeah, home, yeah, quite a Juma Bible to clean having pneumonia, but mostly, no, na bacteria and the virus, no, omunam that I want him, omomutimi. A survival is that cool now. It is a cool muta necessary. Getting into your lungs and the multimedia pneumonia. That's it.
Yo, Madam Wasepa Matthias, say me who send a messia canon. And yes, so be in a hona and Frabaco pneumonia. Name mom when you're cold, obey me and pneumonia. That's okay.
Okay, yes, yeah, that's it. Okay, Mpako home. Why, amen for. What's your kasa?
We are Dr. This had maybe about the past. But I'm going to because pneumonia, the other day, a cold. None of the so nipping to like a bit into a ice, especially this season. Do you have something to say about it? About my yeah, me think you father suffering the eyes. You can continue to walk out with criminal. Although when you're cold, when you say pneumonia, and advice to them or yes, you don't move to eyes.
Okay. I'm gonna leave that question to my fellow respiratory therapist, Raya.
Banjo, other question is 17 years. Say, so no ice water, and that's when you're cold and not flu, and now come out and
yeah, I'm sure Abigail, so respiratory therapist, so about one of
okay, no one can say.
Okay, Abigail, Abigail's husband.
Maybe I should wear me and Cassamy percent bisa questions in the OBA.
Okay, Abigail husband, so I have to answer. Then my question. Okay. Mr. Ada, so wait me I said to move because also no my sort as and I'm no say. Now kasa no we take akra.
Oh, okay. Let me find something. Okay. That season, you're trying to cold the time. You need to say, yes, I don't know. Also, go out and I don't know, okay. Go up the ice, why you addicted to towards the ice, or the ice is kind of know the car. The pneumonia, no, and more than the battle, I think that they like cold. I yes, I don't know, and after ice, no, and
Well, medically, doctors also will bear with me. Say ice water itself and ankasa no do see to the other and yet. So they mention the doctors and ankasa they can. But no ice water no more there ain't me and leading to pneumonia. It depends. Say in sooner or no. Say I infected with bacteria now viral be an yes, that one you can get it. But ice water ankasa according to doctors and almost say no ankasa said that. Enyema ye nipediano but ubetimi enya when e bia nsuo na wo no aye infected and I say this and after so say bia ice no so mo pay ice too much so say be na no we dey enye respiratory but bi on ma no me anemic nti no so betimi abasa with us.
And I think that somebody asked a question, said, and pneumonia affect our lungs. Yes, if that's the whole thing. The whole pneumonia, is just about lungs, inside, being the alveoli being swollen. And so yes, it does affect your lungs. And for somebody said, can a person get asthma from the weather? Yes, when it comes to asthma, there's different types of asthma. So asthma can be triggered by the weather. So if it gets too cold for somebody, it could trigger their asthma, it could trigger their breathing. So like when you're walking outside and it gets cold, now snow, you notice that when you're breathing, it's very, very, it's different from when you're breathing on a regular. So yes, a cold can trigger your asthma.
Remember crack down asthma no a broad topic. Obi wo no ma unse so many broad topic we on my dey wo no bi also be nya due to carpet be so fie and now more be a wo fie it's a feathers maybe to me a cause a whole lot of asthma a broad topic and then you ever had that pet one day be near kitchen because I am very broad asthma yes so they also kind
Okay, Auntie Abigail.
Yeah, dog me that say as when I'm sure upon presentation or the amaye. Nampa show in Titamiti, the Mukina, let me be say, won't say your hospital acquired pneumonia. Into not from what she's saying, not to say, baby are not admitted or be not only pneumonia, until not she say hospital home maybe viruses ne bacteria number from memu and now I want never honor a ma the praconity acquire a pneumonia or hospital nana. Patch me question.
Yes.
But, okay. That's already on one could be answer.
Okay. Thank you.
Pneumonia and that Kama you become this pneumonia, not purely and it's a bit my affair now with pneumonia. We are the top of the saying very high. It's really feel and you're not treatment now.
Bra, me pacho okasa na nye clear ya nte
kra. And they can't hold on over answer. My wife is not because
they say you diagnose pneumonia or hospital, then it's hospital acquired pneumonia. And now unya pneumonia, the chance of saying be high. And the other unya no fear and I say community no na you treat here over hospital now saying be and no that second diagnosis since I happen in hospital no and one my friend in hospital acquired pneumonia and that say most in it the best hospital because you believe say professionals now or no they didn't follow infection control and maybe a mouth or transmitted mouth the same way so now or ventilators so now say when pneumonia as long as we own ventilators from one your best friend or ventilator acquired pneumonia which is bad And it just shows time they diagnose, if we were hospital settings and all that ventilator, so and I say, we no community in one, I say, so naming no, I show you just baby on yan. I know someone to you.
Okay.
Okay, Obi be say a question with chat in also most respiratory disease cause wheezing. Is it a symptom or sign of respiratory distress? I mean, can anybody help? Any symptoms or signs of respiratory distress?
Which question? Most most respiratory can cause wheezing is a symptom or sign of wheezing no yeah symptom and I said respiratory distress.
Yeah, I mean, question is not that clear. Yeah.
Honestly, when it comes to wheezing, it could be either. It is a symptom of something but wheezing nankasa is just meaning your airway no ne close it and the air no is trying to seep through your airway. Wheezing no is just the noise that the airway does when it's closing, it's being restricted. So that one could show us but when it's a symptom, it's just showing say maybe asthma attack, and I say you're struggling with breathing, which is also a sign of, so it's the same thing. It's the same thing. It's just a symptom, but it's also a sign of respiratory distress.
Okay. Another question from
Patrick, about breast sound now, say pneumonia, the doctor the stethoscope to ATO Lancer, sound no your friend of crackling. I knew it different from wheezing. To crackling, they said they say don't suffer dashboard, so I sound now making what to be visa. And sometimes symptoms I should say flu. That's you're treating them per se that no say you say be pneumonia and that's a great pneumonia. The breast sound alone, no, I say if it's the crackling one, I we could tell say pneumonia.
It looks like in the question somebody was asking what is the difference between asthma and wheezing. Maybe that's what they were trying to ask.
Oh, okay. So asthma is the disease. Wheezing comes with asthma. So asthma, there's an asthma attack. When somebody has an asthma attack, they will wheeze, like they're fighting to get air because their airway is restricting. Or sometimes even just somebody could be a patient could be laying there and they're wheezing. They're wheezing because they're struggling to breathe. So asthma comes with breathing, but it's not like there's two different diseases. Asthma, the wheezing comes with the asthma. So I don't know if somebody else want to explain it better, but it's not two different diseases.
Is it like wheezing can be a symptom of some respiratory distress or respiratory illness, and asthma is a type of illness that can cause you to have wheezing, but not all wheezing is caused by asthma. Is that fair to say?
Yeah.
Okay, another question from the chat. Is there more than one kind of bacteria or virus that can infect your lungs to cause pneumonia? Can that same virus possibly travel through your body to infect another area? I mean, I don't know what he's talking about, other organs and not something like that. This is a very, anyway, I will leave it to you, Adley.
Maybe I have my bio.
Yeah, and other aspects, if anybody can answer this question.
Bacteria na affect lungs. It makes us travel to another organ.
Yeah.
Wow. The immune system are weak. Next is the pneumonia, a deadly one. Next one with different types of disease you one. So far as a viral bacteria, there's all about the chance. So this is the chemical. We have to be as a short of our body to be, yes, like the transfer to another organ. Are you weak? And that's the immune system. Are you weak? Or so different. You are never the TV like your blood efficient tension those kind of things that what do you call it? Lungs. It is we have the kind of say we not have bacteria and not virus. Like if my background just sits here, so say respiratory disease. But the pneumonia, flu. Nanti bi pam wanya. COVID no so so say COVID now I guess I'm also see a bar actually affected half from months but it affecting him of the month. We are all actually like for yes, the week system you affect to other ones. Yes.
Right, but your kasa yeah, ain't that clear. Why? I'm say, yeah, share my aye.
Okay.
But you mentioned me you saw on one of phone TV and make us have me say very clear.
Oh,
So
okay. Oh, dear, clear.
me usually my phone and I'm interviewing man most of it, So bacteria as a cause a bit more cause pneumonia, no. The bacteria also they fall under different types of different bacteria. Most in test what kind of bacteria cause na bacteria cause no bit my show you the one be treat you so me name say beginning no me name say during presentation no or can what one treating pneumonia what it might lead to a bit might lead it to so and can mean I know they meet me I'm a baby at 3 minutes talk beyond on team patcho okay what pneumonia can lead to a normal pneumonia bit might lead to say yeah or also okay that's what I can. Oh okay so meaning says pneumonia no if it's true bacteria mostly yebema antibiotics say antibiotics na say and into say antibiotics obo how man no na ever say within 2 or 3 days na no atono but then no almost say me example say one fan say 10 bottles send them that's all half one bottle can na it's recommended so be 10 bottles ni nya ho to we no kra no ni nya because it may back easily and I say wo alveoli no and I say bubbles na wo lungs na air exchange oxygen exchange say fluid no kogum na say pneumonia yentman treating ya the happiness fluid no enema lungs no inflamming so with time no it lead to athleticism no it is all lungs are collapse and when you do better ventilator so no it do on my I very severe and no go for who is the be athleticism so who in terms of in terms ability to flow effusion no lungs are collapsing say a man from abegina wo ama space abeda wo lung ne wo rib cage no nti etime food wo omonebitum kogyan on ekogyan on no say very deadly one treat no so ana be pneumothorax and also no I say yeah pneumothorax so different but it's right now obi of flu it may lead to pneumonia one treat it may lead to athleticism on person be draw no ma the only way bit ma I said over to ventilator so one of the main because I was here blowing lungs near say be and from a bit ma more in the air say there's no a different types of bacteria which ma was when but Nina this lab work and say a true this bacteria and also a better we on the fast so they are actually true pneumonia. I don't know.
Any more questions? Yeah, Doctor, we can say now we can long. At what point, maybe a Bema Nimpa we had long transplant. So we since you long na collapse nga kahuni I mean, just ventilating a bit me as of one. I'm asking a general question for audience, So ventilator can solve it, and I say going in a long transplant. Why do you need a long transplant?
About long transplant, the patch of nim where is about the minimum say the good point I was said to ventilator so then right now ventilator the more pressure na it blow up or alveoli I say bubbles I as the lungs na no exchange with for oxygen no. Nti say do time I collapse here. Right now no, yeah the pressure ekuginem. The pressure na my inframa a blow lang ne apa na ma inframa to ekuginem na exchange here. And na asa I release it, but I release it to the point say better collapse you. Nti it depending how severe our lung are damaged. So lung now damage too much with time, you know. Lung be healing. You hear enough pressure to blow up your lung, then you can come out the ventilator down the line. But say a collapse to a point, determine who you know a damage a lot. Others so obey ventilator dependent. And I say I heard him say a bear lung transplant. And I say in there, but you know beyond me scope.
All right. Anyway, Mr. Lung trumpet comes in when there's smoke, and then when you pneumonia, I mean smoking, you can cause it. Anyway, Dr. Sarah Pepra.
Yes, thank you so much for the presentation. I just wanted to make a comment and then a question. My first comment is that it's very important to get our updated flu vaccines. I know a lot of us don't want to get vaccinated every year or even the COVID vaccine, but the flu is something that can actually kill, and especially for pregnant patients, we really encourage them to get flu vaccines because when you're pregnant, your immune system is a bit weaker, and so you can get very sick easily. So please, everybody, get your flu vaccine. If you don't have an allergy to the flu or egg, then you should be able to get the flu vaccine. Otherwise, wash your hands and distance. Otherwise, my second question, Adelaide, Asa, is there a way we can increase our lung capacity? Like I see all these like swimmers or these like athletes, and I'm like, hey, the way they're able to breathe, they seem more efficient. And I just want to know, is there like things or exercises we can do to increase our lung capacity? Thank you.
Okay, thank you for the add-on. And from me, so when I go to work, so I work on the floors, and I work also in the PFT, which is like a pulmonary function lab. And what we do in there, what we advise people to do is exercise. Most patients that come in there, they're smokers. So when they come in there, most of the time their lungs is not working as it's supposed to be working. And what we do tell them to do is at least like exercising can help build the can help with your breathing. So exercise breathing, sometimes you could go let's say you could go to your window and just start taking a deep breath in all the way in, hold it, and then release all the way out. So like you're training, not more so training, but you're exercising your lungs in that situation, if you get what I'm saying. So exercising can help build, and those athletes, there's a way of that they breathe. Or even when you're singing, there's a way you breathe when you're singing. There's a way you are able to hold your breath and then able to sing and then releasing it. So it's all about exercising your breathing. You could even when you're sitting home or you're sitting in your couch and you're breathing, yes, you breathe in unconsciously, but you could just sit there and then just start practicing taking a deep breath in and then holding it and then releasing it. So just exercising your breathing and just exercise in general helps.
And again, medical can come on. Tell when you say, at that time you were not there. So when we were in Ghana, we used to blow balloon. So you who balloon and we went up extended this thing to exercise our lungs. And at two, who says will be quiet post like after surgery, the amount of incentives parameter
Before.
So before and after, don't go back to surgery now. The amount that incentives parameter and say if you blow me on lung capacity. Say the way I will be you can't say who be surgery so I heard say we say bro, me and Caribou said more 10 times an hour or something. Mean that part of the way I see the exercising along. Like a lung, and I said, "Maybe I find your lung with us."
Thank you. And sorry.
If I may, I think oftentimes when we say exercise, we don't really clarify what we mean by exercise, especially exercise that will benefit our body and our lungs and our heart as well. They work and function. Sometimes, like, you go walking and you're like taking your time walking, we like to do that. It's nice. It helps clear your head, is great for your mental health, but that is not necessarily like the exercise that will strengthen your body and your lungs. You want to do something at least like 30 minutes, a couple of times a day. You don't have to do it every day, maybe twice a day. That gets your heart moving. If it's going to the gym or walking upstairs, going to the gym, you don't have to lift weights. You can go on the treadmill, use ellipticals. Ellipticals are really great. You use the force of gravity, it makes it easy and it gets your heart pumping. So when we say exercise that will help with your lungs, total vital capacity, you want to do something that gets your heart pumping, because that's going to get the oxygen flowing and that's going to help your lungs. So yeah, make sure, it's nice to walk, casually, just to de-stress, get rid of all the, stress for the day. But you also want to make sure you're being active where your heart is really, really pumping, where you're like, you're catching your breath. That really, really strengthens. And that's what we mean when we say exercise.
If I could ask another question.
Okay, yeah, Dr. Sarah.
So the air that we breathe here in the city, is it okay that we're breathing it, or is it something we should like get out and breathe like nature, or what can we do about the air quality that's in our house and as we live in the city, those of us who live in the city?
As we know, we are barely around any trees in the city. We are our air is very, very polluted. What I do, me personally, what I've read, what I do recommend is having plants in your house can help with the air quality. So that's why I think, because over here we barely have trees. We just have buildings here and there. Whereas to where I was in upstate in school, all I saw was trees. The quality of air is way better. But if what you can do is probably have a plant, or even in your backyard, breathing air where there's like trees around is better than breathing air where there's no trees around. That's what I would recommend.
Sister, how about having a humidifier? Will it help or boy? And
I don't really know about the humidifiers like that. So if somebody has an experience with a humidifier, because I don't use air humidifiers. So
any experts on here, whether humidifier helps?
But in actual fact, it helps.
Hey.
It helps, but we don't know much about that humidifier, because humidifier mostly OS what do you call it? OS what do you mostly tell you some say the way of me well sleep, but it helps. But I can't give you more details about that humidifier. It really helps.
And also, if you're gonna have an air humidifier, also I think they have filters in those. You also have to keep, because you can't just use it and then just keep using it. It's also gonna collect bacteria that we're talking about. So you have to keep the air humidifier.
Okay.
So
I'm saying, yeah, and two cars are no, but we're now.
Why?
Sorry, let's say if you want you find a boy be more committing every year. Pneumonia, no be an coffee nickel, but if you want coffee nickel, but you coffee the uniform is and we find something so bounces me and spread it through the air. And also to the part, if the carbon pneumonia began virus, there, and that no about it. Also, question of people saying, I know say you see we think we have the worst of almost everything. But community system has to be everyone's really not a great place. There's a lot of factors. The person also find breathing a lot of things that's from the outside. It's also very harmful to that person. And that's also it's expensive complicated. But more a big sawmill farmer. You're also breathing things that can also it's not good for the farm. Maybe I would say can make a lot of difference, but more what will be react will be better reacted to sawdust, but will be reacted to it. Maybe actually not makes it different, but it's really hard to say that I'm going to affect you one and not the way they affect one and the way they affect you. It will be to village and it doesn't necessarily mean and also around the beach or better air than what when it comes to non-disease. It's just my opinion.
Auntie Grace, Auntie Stella.
Patrol, me one question. Person maybe say cleaning stuff like Lysol, and then you can kahona. A high smell now say. Who make home? What is it? Says I make us will be a spray Lysol. Man who make a grade. Yeah, now I'm finding it difficult to breathe. And also let me lead you to something like the topic we are talking about. And say, in say me were a lot of allergies and masano, pollen pneumonia, the high scent of those liquids. And what is your advice on it, please? And what should I do? Thank you.
So,
Pachomotimenka.
Yeah, and to say your tunka, yeah.
Now. So, if we are to Sana manager and advice is the other Udi around me and get fresh about getting it from my but so who oriented to Sana manager also find Adam Mal method. It tended to a very effective thing.
If I talk as animal, I don't know, Samina Mentia.
I'm just baby or na. Baby or no. Yeah, what I mean here respiratory, but me meet ma at the crack and one. See, I cry workers and workers and coy.
Yeah.
A baby was all boy, the baby I want. And as a son, those spray no. Be one in the bathroom corner. I did be on them because so best smell sabi ujan and those particles no. Apart from say bit my also other respiratory stuff no. Also what the can so allergies a lot allergies be brave. I don't know more spray no. Unko test be and say ABA allergy be woman as we need be home. See how kasa enko ye no. ABA na bit me how on you brave. Tis a bit my boy dear idea better bebo pa. Adie bia engen natural nipa na ye de chemical aye bia no e betima mo ayare ida se ohome ko mu o mene ne sa na mani na no enga de beboa sisi akasa nko e betima firi ba bia wona eye ama we na firi hon man se na akọ hon ma nke ada nke bobo pa.
Okay, that's it.
Okay, yeah. Mrs. McCarthy, woman says so. Yeah, you question and I say, come more last question. Now you're Bonapo.
Oh, John, but you may have time in none say it be a time of.
Okay, I'll give you the last question.
Obi or enclosed area, baby, where enclosed Capredia and Honety. A big car last week or for last week, and then Honety known to me home. But I know so no a bus topic when one the person who say a na Obi was a condition and then over to me.
I think that no, there's more so claustrophobic. Like the person who you're claustrophobic, whereas it's more psychological. So it's like when they get into closed places that already in their head they're thinking said they're not safe. So the body starts to react as the body goes into panic mode. So it's not more so say it's a disease, but it's just the person is claustrophobic. I don't know if you understand.
And ebiem so ebia na ɛhɔ no ventilation no, especially oxygen no, inflow hɔ no much into no home no. We be sorted of breath into another so one of them. So they also see kind. So oxygen on any more waiting any side they all can home no according to me home. And there's all open space. So they are between a catch it and on what maybe be well. That's
Okay. Yes, you Sister Adelaide. You do wasipi nyamisho pi. Umwa ya shares no money had in the topic in no respiratory disease. Sister Adelaide or catching also Dawson, but you will focus on pneumonia or kind of causes, also be a bacteria, virus, fungi. And the symptoms, saying you be coughing, being a fever, chills, in a difficult breathing as a now time of from on painful because the immune system is weaker until here in brain say you danger and catasian. The treatment is also bacteria, antibiotics, fungi, antiviral medication. Prevention, prevent more kind of good hygiene. Say the mom you more hospital also be fear answer but busy say can be a one son another baby them. If you so if you sick isolate yourself. I mean you have running nose na zin mon ko yimpem na get rest and so us yenda ye anda ka shede man na you are still on your phone me nyamado just get proper sleep ni no boy in na fin so ultimate final word us yan fan paibo nyankopon is ultimate healer to me yem fin yankopon ti some crowd kind antlade also bonitof na fi me announcement na yem fi adwumadimbre we.
Okay, that's it. So basically the whole overall is that pneumonia can get very serious. It could lead into, like you said, atelectasis. It could lead into way more serious diseases that could be life-threatening. So, like I said before, prevention is better than treating. So, before say you better wash your hands, protect yourself. So, you have a cold that make sure you isolate yourself because you don't want to go and your immune system able to me fight it, but me obi immune system known to me fighting the same your fight it. So prevent, and pray. Number one thing, pray. God is the ultimate healer, so he always come through. And thank you guys for listening and giving me opportunity.
yeah, so I'm fucking to be come with it. Yen try say yes, with it. Mr. Yen try say you will fear. Say they now so can exercise like a breathing exercise, So who breathe in, let's all tip sharp pen be. O side now lungs no na me slow and fen niagro. Ko hu doctor ntem. A bit my pneumothorax. Dear who cry sa tension pneumothorax no. A bit my you can say pneumonia. A bit my pleural effusion. A whole lot of stuff. Just all who breathe in that sharp pain. Yes, so ko hu doctor. Na say a bit my child extra and I say this madam.
Okay, nyansi da wasi. Announcement when Ochina Yabotuado, no change point here because Dr. Enoch Boateng, Mr. Mumfre Mayankofo, na we na umbete fly and so won't keep on from Mancrofo, Ochina Odo, a last day, the Zumba, ye. No China Principal School, a Bibia no put no num capim no sia, Ochina Fida, Yabobo the whole week in Tofa, or ye Dr. Quatin Papa. Aribioyen on obezenyim zame he nti na kwesida so homeda ye zadin na bebebe no so wombrantem osan pebe no nsian ho ampada ye check mo vital sign blood pressure kaka una din na mombrantem obese breakfast na aze woni na wombra ai ye de ho ase na mesre da odifo Honorable ma wishira addition is that mehe elder sawoda mpocho bompe ne share for mehe
Gajo motimi gasa
mpocho yete wonka
ejide for me mo empire eja wasro enumre onko anu fran ya da wase was papa ewo addition onum ye bay eso abakire onyame fitianhye no obo ade na nka yare eni ho no nipa ya so den ene ye boni nti ena ekofa yare braye nti anwumre ya sraw hwemobo kwan onam so akire ye penimfo bi se obetime ma aduane aye wadru sanya sa wadru ebeye waduane ye de yempene sa epese ye aduane ye die eye adru anti anwumre do akire ye se yenhwe ye sanse onipa se wontime enhome a eyade a ye impo se wuso na supo hinu wo no se de sitie na base opese wo home na wontime home sa yare we nyina enam framamu baby etete de nenam baby aye kro ena kofa sa wo hawo nyina ede braye enti anwumre de esuen yesrew boaye na wo ye doctor panyini no sempo ye ne wala esu ye wo hawo bi ana ye nuanum bi wo sa wo hawo bi ewemu a yewura yesrew tutu asema anwumre sensa baba we wo kire kra wo se dia ndefo nim nyina no se wonyame wonka ho a enya de ebeye enti Awurade bra ya to nsa afre we anwumre be hira wo mada na boa yen ntim tutu anamo a ebeboa yen na ne kasepa no yatena asetena enkofa yare empa mre yen anwumre emu bi ofia ye bedida bebrebe so ewa adwuma mu a obefiri wa bafie ebibi so befiri fie akwa adwuma mu odomfo no mbrohomfo agye o ma yedisanfo nyina yede ho hyew nsa se boye nyina ho ban ne ho amasem bi ede wase na wotwe afutuo ne kirakira wodi aman boye mientimi ni so mientimi ntina sesena pamman baba wa obesua abekire yade sua yede ne hyew nsa yewura manenemdie manenyansa shira no de oye nyina na mana hodin bia yewura wa hwere no anwumre bira wa kirakire wa hyena nam de pa bi so to nsa frɛ no a osan be kirakire yede aboafo ne akasafo ene wo mu a bisa nsɛm nyina hyew nsa yewura esrew hu ye nyina mobɔ ne de ahaw bi da no so amane bi da no so no wa hyehyɛ wa sere nyina aman yede wase enim so obɛyɛ aman na abetie sanse yɛsɛ no yewura ni agyen kwapa Awurade Yesu Kristo de mu nti amen
Amen. Amen. Amen.
Amen.
Okay, no sasafo. Ejidifo na hotewofo na hokho a mbeka ye ho me ya adesua eyimbiri. Midi hena agyen kwezi scratch ne zin ma ye nyina ye ho mespa.
See,